So I've been reading through your comments, and questions that keep popping up over and over again have to do with sexual side effects from antidepressants. Well, in today's video, I've got you covered, because by the time this video ends, you're going to know answers to the 5 most common questions that I get asked about. And these are: 1, can antidepressants ruin my sex life? 2, which antidepressants are most and least likely to cause sexual dysfunction? 3, what strategies can I try at home to help manage sexual side effects? 4, are there any supplements that I can take to help reduce sexual dysfunction? And 5, how do doctors treat sexual side effects when seeing patients in clinic? So stick around. The first question we're going to tackle is, can antidepressants ruin my sex life? And in order to fully understand this, we need to zoom out real quick and take a look at sexual dysfunction as a whole. There are 2 big things I need you to take into consideration. And the first is that sexual dysfunction is one of those topics that can be pretty tricky to study, because there are so many different variables and causes to take into consideration, right? Medical or physical causes of sexual dysfunction can include obesity, diabetes, or heart disease. Psychological causes can be anxiety, depression, marital and relationship struggles, or effects from past traumas. And then other offenders could include drugs, alcohol, or medications that are being prescribed to you. And the list goes on and on. But when it comes down to it, we know that sexual dysfunction is common in the general population, and it's estimated that over 1/3 of men and women experience it. The second thing I need you to know about are the basic characteristics of those who are depressed. Research has suggested that people with depression are more likely to be obese, have diabetes, and have cardiovascular disease than those in the general population. So if we remove the factor of depression itself, these 3 variables alone would put you at higher risk for sexual dysfunction. Okay, now that we have these 2 major points established, let's talk more about depression and antidepressants. It's been shown that both depression and many of the medications used to treat depression can cause sexual dysfunction. So let's break this down further and first look at how depression itself affects sexual functioning, okay? So there was an interesting study that was published by the Journal of Affect Disorders, and in it, they looked at 134 patients with depression and evaluated their changes in sexual interests, sexual functioning, and sexual activity before going on antidepressants. And what they found was that over 40% of men and 50% of women reported decreased sexual interest. In addition, 15 to 20% of people described having difficulties with orgasm or ejaculation. And then on top of that, the likelihood of symptoms popping up are increased if you have a more severe form of depression. Basically, what this is saying is that untreated depression will likely affect your sex life in some way, shape, or form. So now, what about the antidepressants themselves? What can you expect with treatment? When SSRIs were first launched and hit the market, the initial drug labels stated that less than 5% of patients in the clinical trials reported sexual dysfunction. Over time, research has suggested that pretty much all SSRIs, SNRIs, TCAs, and MAOIs carry some sort of risk of causing sexual side effects. And it's estimated that somewhere between 30 to 60% of people will experience this. Keep in mind, though, that these studies have shown rates as low as 10%, and then also rates as high as 80%. So there's quite a big range that we're dealing with, and more research definitely needs to be done on this topic. Now, what kind of sexual side effects are we talking about here? Patients have described experiencing decreased sexual desire, decreased sexual excitement, diminished or delayed orgasm, erection problems, and difficulties with ejaculation. And why does this happen, you might wonder? Remember, there are many different neurotransmitters involved in sexual desire and sexual functioning, and antidepressants have been shown to 1, increase serotonin transmission, 2, cause hormonal changes such as elevated prolactin levels, 3, cause sedation, 4, block nitric oxide, 5, reduce acetylcholine levels, and 6, block noradrenergic receptors. All of these things individually, and especially when taken in combination, can result in sexual dysfunction. So what's the verdict? Can antidepressants ruin your sex life? And the answer is maybe. Some patients will experience sexual side effects when taking antidepressants, and others will experience improvement in their sexual functioning as depressive symptoms become better controlled. So the way I help monitor and tease this out with my patients is by having them fill out sexual functioning scales throughout their course of treatment. One of my favorites is the Arizona Sexual Experience Scale, and I provided a link to it in the description below so that you can use it with your doctor. And this scale has a score range between 5 to 30, with higher scores indicating more sexual dysfunction. It looks at things such as sex drive, arousal, vaginal lubrication, penile erection, ability to reach orgasm, and satisfaction from orgasm. So ideally, it's best to have you do this while you're off your medication and symptom-free from depression, anxiety, or whatever else you might be struggling with, so that we have an idea of what your baseline sexual functioning looks like. However, this isn't always possible, so at a minimum, I will have patients fill this out prior to starting their medication, then I'll have them fill it out again a couple weeks later after initiating treatment, and then again and again after any dose changes we might make. Okay, so now that we've established whether or not antidepressants can ruin your sex life, and you've learned about ways to monitor and track your symptoms, the second big question to answer is which antidepressants are most and least likely to cause sexual dysfunction. Well, there have been multiple studies that have evaluated this, and what I'm going to do is compare the 5 most common antidepressant classes so that you can have a better understanding of the level of risk that you're taking when starting a medication. Now, if you're looking for an easy way to keep track of all this information, make sure to download my PDF in the link below because I already have this nicely organized for you. The first medication class that we need to talk about are the SSRIs, or the selective serotonin reuptake inhibitors. If you're being put on an antidepressant for the first time, odds are it's going to be a medication from this class. And that's because these are often used first line in treating depression, anxiety, OCD, PTSD, and the list goes on and on. The medications found in this drug class include fluoxetine, sertraline, escitalopram, citalopram, paroxetine, and fluvoxamine. The rate of sexual dysfunction seen with the SSRIs is thought to be somewhere between 30 to 60%. Right? But what you need to know is that the range is quite variable, and some studies have shown rates as low as 10%, while others as high as 80%. And regardless of the exact number, the big takeaway is that there's an overwhelming amount of evidence suggesting that high rates of sexual dysfunction are seen across all the SSRIs, okay? Now, when comparing one SSRI to another, studies have not found a huge statistical difference between each of the medications, but there's some evidence suggesting that fluvoxamine might cause the least amount of sexual side effects, while paroxetine might cause the most. The second medication class to look at are the SNRIs, or the serotonin and norepinephrine reuptake inhibitors. The 2 most commonly prescribed medication in this class are duloxetine and venlafaxine, and the rates of sexual dysfunction for SNRIs are thought to be generally comparable to those of the SSRIs. When comparing these 2 medications head-to-head, it's believed that venlafaxine carries a higher risk of sexual dysfunction than duloxetine. The third medication class to know about are the TCAs, or the tricyclic antidepressants. And these medications work sort of like the SNRIs in that they affect both serotonin and norepinephrine. And what you need to know is that some medications in this class affect serotonin levels more strongly than norepinephrine levels. And remember, increased serotonin reduces both sexual desire and sexual functioning. So for example, clomipramine is one of the most serotonergic TCAs and is the worst when it comes to causing sexual dysfunction. On the other hand, desipramine and nortriptyline affect norepinephrine more strongly than serotonin, so they've been shown to cause the least amount of sexual side effects. But when looking at the class as a whole, it's thought that the TCAs carry around a 30% risk of causing sexual dysfunction. The next class of antidepressants are the MAOIs, or the monoamine oxidase inhibitors. These medications, like the TCAs, are used less frequently, and the rates of sexual dysfunction that I've seen range somewhere between 20 to 40%. The exception to this is the transdermal selegiline patch, which has been shown to have rates of sexual dysfunction that are comparable to placebo. Okay, at this point you're probably thinking, so are there any medications out there that don't cause sexual side effects? And the answer is yes. This takes us to our 5th medication class, the atypical antidepressants, and there are 5 medications in this class that are commonly prescribed that I want you to know about. The first is mirtazapine. The majority of research for this medication has demonstrated that the prevalence of sexual dysfunction is lower than the vast majority of the medications that we just talked about. Rates are generally thought to be around 24%, okay? The next medication is trazodone. Not only is it thought to have lower rates of sexual dysfunction, but also earlier reports have documented the potential for it to cause increased sexual desire and prolonged time to orgasm. But don't forget, this medication does have the risk of priapism in men, which is a prolonged painful erection. So you definitely want to monitor for the side effect if you start this medication. 2 other medications to be aware of are vilazodone and vortioxetine. Both of these medications so far have been shown to have rates of sexual dysfunction similar to placebo in randomized controlled trials. And the 5th atypical antidepressant that is one of my personal favorites is bupropion. There's strong evidence showing that this medication has less sexual dysfunction than all the SSRIs, SNRIs, TCAs, and MAOIs. Not only do sexual side effects occur at or below the rate of placebo, but there's some evidence suggesting that it actually has a positive effect on sexual functioning by increasing sexual desire. So now that you have a better idea of which antidepressants are most and least likely to cause sexual side effects, we now need to talk about treatment options. And the next question to be answered is, what strategies can I try at home to help manage sexual side effects? Tip number 1 is to change the timing of when you take your antidepressant. And this is going to work best for those of you who take your medication only once per day. What you're going to want to do is figure out the time of day you typically engage in sexual activity. And then you'll plan to take your antidepressant after that point in time. So if you're someone who is more intimate in the evening hours, say at around 9 p.m., you'll be at your best performance-wise if you take your medication right before going to bed, so maybe at around 11 p.m. And the idea behind this is that the side effects of your medication should be the least bothersome a few hours before you have to take the next dose, right? This is when we see the lowest blood levels of the medication in your system. So we want to try to align and coincide this period of time with when you're looking to be intimate. Tip number 2 is to exercise. And you're probably like, I am so sick of doctors telling me to exercise. But hold on, okay? Hear me out on this one. It's been shown that those who exercise before sexual activity will have increased sexual desire. And this is because exercise leads to sympathetic nervous system activation, which has been linked to increased genital arousal. And there have been multiple research studies that have demonstrated this, and this is especially true in women. One of the studies in particular took 47 women who had antidepressant-related sexual arousal problems. Each of the women went through 3 different experimental designs. In the first design, the women were instructed not to exercise. They then watched a 3-minute neutral film followed by a 10-minute erotic film. So a porno, right? The second design had the women run on a treadmill for 20 minutes, wait 5 minutes, and then watch the neutral film followed by the erotic film. And the third design was similar to the second one, but instead of waiting 5 minutes, they waited 15 minutes before viewing the films. And what they found was that genital arousal was greater for the 2 exercise groups compared to the non-exercise one. And when comparing the 2 exercise groups head to head, sexual arousal was significantly higher in the 5-minute post-exercise group than the 15-minute one. When it comes down to it, exercise before sex is something that is so simple, yet can be a game changer in those who have decreased libido from antidepressant medications. Tip number 3 is to take a drug holiday. So what does this mean exactly? Well, there was a study published in the American Journal of Psychiatry that looked at people who reported having sexual dysfunction when taking an SSRI. Researchers instructed the participants to not take their antidepressant on Fridays or Saturdays over a 4-week period, right? They would take their medication Monday through Thursday, hold it on Friday and Saturday, and then resume it as usual on Sunday. And what they found was that there was a significant improvement in sexual functioning on the days that the antidepressant was not taken. Now, there are some things to take into consideration with this approach that I need you to be aware of. The first is that this will not work for every antidepressant out there, especially if yours is one with a longer half-life, such as fluoxetine or Prozac. It probably won't work either with medications with super short half-lives, so ones like Effexor or Paxil, because this might cause you to have withdrawal symptoms. The other factor to consider is that if you're not getting the full amount of medication in your system throughout the week, it might not be as effective in controlling your depression or anxiety symptoms as you'd want it to be. So some people will take half of their medication dose on Saturdays and Sundays instead of stopping it completely. So when taking all the factors into consideration, this approach in my mind is best for those who have had stability of symptoms for quite a while, those who aren't on a medication notorious for causing discontinuation symptoms, and those who aren't on an antidepressant with a super long half-life. Okay, now that we have a better idea of some behavioral strategies that you can try at home, it's time to answer question number 4. Are there any supplements that I can take to help reduce sexual dysfunction? And there are 3 that are commonly used that you'll want to know about. But first, if you've been finding value in this video so far, make sure to hit that subscribe button so that you can be the first to know when new content comes out. The first supplement that you need to know about is S-adenosylmethionine, or SAMe for short. So what is SAMe? It's a naturally occurring substance that is found in almost every cell of your body. It has many different functions, and some of the areas that it helps with most include sustaining a healthy immune system, maintaining cell membranes, and producing and breaking down neurotransmitters in your brain. And we're talking about the big players here, so serotonin, dopamine, and norepinephrine. So how does SAMe help? The journal European Psychiatry published a randomized controlled trial that looked at whether or not SAMe was helpful in improving sexual functioning in men who are on antidepressants. And what they found was that those who were treated with SAMe had improvements in both sexual arousal and erectile dysfunction. Now, how is SAMe dosed? Evidence supports taking between 400 milligrams twice a day to 400 milligrams 3 times per day. And if you're wondering which brands are most reputable, make sure to check out the links below because I included products that have been tested by consumer labs and have passed their quality certification program. Supplement number 2 that you need to know about is saffron, and this is a spice that is derived from the flower Crocus sativus. And there have been a couple of randomized controlled trials conducted in both men and women, so let's start with the ladies first. In 2013, the journal Human Psychopharmacology came out with a study that looked at 34 women with major depression who were stabilized on fluoxetine or Prozac that had reported sexual dysfunction. They were randomly assigned to either a saffron group or a placebo group for 4 weeks. What this study found was that those in the saffron group experienced significantly more improvement in sexual functioning, particularly when it came to the areas of arousal, lubrication, and pain. Now for the men, the journal Psychopharmacology Berlin published a randomized controlled trial in 2012 that was very similar to the one with the ladies. When evaluating 30 men with major depressive disorder who were on fluoxetine, they found that those in the saffron group had significant improvements in both erectile function and with intercourse satisfaction. Okay, so how do we dose saffron? Both of these studies had their participants take 15 milligrams twice a day, so this is generally what's recommended. The third supplement, and one of my personal favorites, is MACA, and this is because it's one of the top studied, most effective, and safest supplements. So what is MACA? It's a starchy root vegetable that has been shown to have a wide range of uses. It can improve mood, boost your immune system, increase stamina and energy, and improve sexual functioning. And many people claim that it's due to its testosterone-like effects. So what's the evidence for this supplement? One of the top studies conducted was one by researchers in the psychiatry department at Mass General Hospital. They did a randomized controlled trial on 20 outpatients, mostly women, who had sexual side effects from their SSRI. They were given either 1,500 or 3,000 milligrams of MACA per day, and what they found was that the higher dose group had a significant improvement in sexual functioning. Now, there are 2 more randomized controlled trials worth mentioning here. The first looked at men with erectile dysfunction, and this study found that MACA helped with their perception of sexual well-being. The second study looked at women who were on either an SSRI or an SNRI, and they found that MACA root was helpful in alleviating sexual side effects, especially in the women who were postmenopausal. When it comes to dosing MACA, 2,000 to 3,000 milligrams per day is what's recommended. Also, when you're shopping for this, you might notice red, black, or yellow MACA options. What you need to know is that there hasn't been a notable difference between the 3 types when it comes to improving libido, but the red and black forms are the ones that have been the most well studied. If you're going to get this supplement, I strongly encourage you to get one that's approved by consumer labs, because recently they tested a product that was found to be contaminated with lead. And remember, no medication, even over-the-counter medications or supplements, come without risk. So make sure to talk to your doctor before starting any of these options. Okay, so you might be at the point where you're like, just tell me what I need to do. I want something that's gonna work quickly and be the most effective at getting my sex life back on track. Well, that takes us to question number 5. How do doctors treat sexual side effects when seeing patients in clinics? Well, there are 3 tips that I need you to know about. Tip number 1 is to reduce the dose of your medication. There was a study that showed that cutting the antidepressant dose in half improved treatment-emergent sexual dysfunction in 75% of cases. And in those who stopped their medication altogether, they had total recovery after a few days or weeks. Now, this strategy should only be used in those who have already achieved full remission on their medication, because lowering the dose obviously carries some risk of your symptoms returning or worsening. So if you're someone who just started a medication or are still having symptoms that you're trying to get under control, you're going to want to consider tips 2 and 3. Tip number 2 is to add a helper medication. Now, there are 2 medication strategies that have been proven over and over again to have a clear, statistically significant benefit when it comes to reversing sexual side effects from antidepressants. The first is adding on bupropion or Wellbutrin to your medication regimen. And this is one of my favorite approaches because it can give you a triple whammy effect. And this is helpful for both men and women. It's been shown to 1, improve sexual side effects, 2, increase sexual desire and improve overall sexual functioning, and 3, enhance treatment of your depressive symptoms because bupropion itself is an antidepressant medication. If this approach is something you're interested in, one thing I want you to know about so that you can bring it up to your provider is that lower doses of bupropion might not be as effective as higher doses. While some people in studies saw benefit with lower dosing, there have been other studies conducted that have not shown improvement of sexual side effects at doses of 150 milligrams daily. When we're looking at the extended release version of bupropion, the doses that we want to be using are 300 milligrams to 450 milligrams daily. The next medication strategy that has a ton of evidence supporting it is the addition of a phosphodiesterase inhibitor to your medication regimen. So these would be things such as sildenafil or tadalafil, also known as Viagra and Cialis. The Journal of Clinical Psychiatry came out with a randomized controlled trial looking at men who developed erectile dysfunction while taking an antidepressant. And they found that those who were on sildenafil had improvements in both erectile dysfunction and overall sexual satisfaction. What's even more interesting is a study that was put out by JAMA that looked at women who took sildenafil, and they also found improvements in sexual side effects. Now, when comparing sildenafil head-to-head with tadalafil, what you're going to see is that sildenafil is the best studied phosphodiesterase inhibitor. However, if you're someone who wants some spontaneity in your sex life, tadalafil is a great option because its effects last up to 36 hours. The recommended dose of tadalafil is 5 to 20 milligrams, 30 minutes to 36 hours before sex, where sildenafil is 50 to 100 milligrams, 30 minutes to 4 hours before sex. Okay, so there are 3 other helper medications worth mentioning that are commonly used that don't have quite as robust evidence supporting them. However, people have reported benefit from them, so they're options I want you to know about. The first is mirtazapine or Remeron. There was a retrospective study showing that people who took 15 to 45 milligrams of mirtazapine in addition to their primary antidepressant had improvement in sexual side effects. However, there is yet to be a randomized controlled trial supporting this strategy. The next is testosterone, and there are actually randomized controlled trials supporting this in both men and women. In men, testosterone gel was found to be helpful in those who were depressed and had low or low normal testosterone levels. In women, they found that testosterone patches helped improve low libido. The third helper medication that I want you to know about is buspirone or Buspar. There was a placebo-controlled trial that showed it was helpful in improving sexual side effects caused by paroxetine or citalopram. These effects were more pronounced in women than in men, and dosing for this medication is between 15 to 60 milligrams daily, and this is usually divided into twice a day or 3 times a day dosing. Now, tip number 3 is to discontinue your antidepressant and switch to one that is associated with a lower risk of sexual side effects. And these include the 5 medications we talked about earlier. So mirtazapine, trazodone, vortioxetine, vilazodone, and my personal favorite, bupropion or Wellbutrin. Now, if you're looking to learn more about this medication in particular, make sure to click that top video.